In this video, we're going to talk about the assessment part of your OSCE exam, and this will form the foundations of your API, which consists of the assessment, planning, implementation, and the evaluation stage. Your assessment station will be 20 minutes, but before you actually embark on the skill, you'll be given 5 minutes to read about the patient. During this time, you start to gain an overview of what's happening for the patient, incorporating the social and the dynamic issues around that patient. While you're having your 5 minutes of reading the brief, you need to start thinking about the focus and how you're going to embark on this station. When you get into the station, be very aware of your patient or your actor. Sometimes you might be presented with a mannequin, but you still have to talk to the mannequin as if it were a real life patient. When you get into the clinical area, you need to be very aware of your own safety and as well as maintaining the safety of the patient at all times. So infection prevention control is a very important key aspect of your assessment. Your personal space is very important for this aspect. And also make sure that you're utilizing a SOLA model throughout the whole assessment. Keeping yourself engaged with the patient. Even if it's with the mannequin, always keep your attention to the mannequin. Do not engage with the invigilator because the invigilator might talk on behalf of the mannequin, but your mannequin presents as your patient. When you start your interaction with the patient, the first thing you want to make sure is that you're talking to the right patient. Introduce yourself to the patient before starting your interaction, followed by identifying your patient by asking name, using the NHS number, and getting as much information to satisfy yourself that you're talking to the right patient. Make sure your patient is consenting to all of the procedures that you'll be doing. So at all times be asking for informed consent, and also make sure that the patient has got the capacity and the insight to give you the consent. Tell the patient you'll be making notes during your assessment, as sometimes that can unsettle patients and it might break your interaction as you start writing down your notes. A structured approach to look at when dealing with this is to first of all look at the reason for admission. Talk to your patient, find out why they've come to that hospital. If it's an outpatient service, why are they visiting the outpatient service? Is this a routine appointment? Is there a presenting risk? All of those things are very important for then forming your next part of your station, which would be the planning. Be very aware of the traps. So look around, make sure that there's nothing in the environment that presents any risk to yourself or to the patient. Think about which observations you need to make. So this might come in the form of an extra tool, which could be a PHQ-9, it could be a mocker, or you could be using the News 2 to get the physical observations. When you start practicing for the assessment station, try not to be robotic in how you deal with the station. One key tool that you could use is the OSCE, which is using open-ended questions, also using affirmations, reflective listening, and summarizing key points in all the discussions you're having with the patient. Try not to pass off any of the real immediate issues that the patient is trying to communicate with you. So active listening is very important for the assessment station. If you use all the skills discussed in this video, you shouldn't find the assessment stage too difficult. One of the key skills that you need to be practicing is saying as you do and doing as you say. So to put that into translation, when you walk into the scene, make sure that you verbalize that you're looking around the environment, checking for any potential hazards. If you're removing any hazards, make sure that the invigilator is aware of why you think that might cause a concern during your assessment. When you're checking the identity of the patient, make sure that you're physically looking at the name badge of the patient, marking that against your documentation. Your patient might present with allergies, so you need to make sure that the patient is also wearing a red allergy band. If they don't have one, communicate that with your invigilator, making sure that you would have one available at earliest convenience. And also incorporating some of those things covered in the code of conduct. In your questioning, make sure you conduct a holistic assessment. So don't just focus on just the key risks. Try and get a full overview of the patient. Also, this shows interest with the patient and it shows that you're fully engaged with the whole assessment. Affirmations are very important. So before you leave your patient, make sure you summarize the key points of the discussion you've just had with the patient, and also summarize the key points of the actions you're going to take following on from that assessment. This will be very important for your planning, implementation, and your evaluation stages. And also make sure that you've covered whether the patient has got any capacity and consents to the actions that you're going to take. Hopefully the information I've given you will help you towards passing your OSCE for the first time. My name is Michael. Please like and subscribe to the channel, as we'll be covering the rest of the theory and other stations covered in the mental health OSCE exam.